20 gauge 1 to 1.5 inch needle. Okay. Next muscle group is going to be your gluteal muscles. You're going to stand beside the horse. This is the one they don't like as much. You're going to take your needle, probably an 18 gauge 1.5 inch needle. You're going to dart it into the horse's muscle, and then you're going to attach your syringe, check for blood, and inject. The landmarks here that you're going to want to watch out for are ischial tuberosity is going to be your sort of cranial landmark. Obviously, you want to be, again, off the spine, so we want to make sure that we're at least hands width off of the spine. And then behind we have our sacral tube. I think it's called, I'm forgetting what the actual name for that one is, but basically if you draw, again, a triangle between those three, and then you're going to put your needle right in there, okay? Then the next muscle group is going to be your semitendinosus and semimembranosus. Semimembranosus is medial, okay? Again, you're going to be standing beside the horse. You're going to use a 20 or an 18 gauge 1 inch needle, and you're going to put it in perpendicular to the skin, check for blood, and inject. You want to be approximately the level or slightly below the level of the anus. Our next and last choice for muscles would be the quadricep muscles, which would be right in this location. This would be, again, the last choice for a small volume injection. All the rest of the muscles are used, okay? For intravenous collection or injections, our choices are going to be our jugular vein as number one. We're occluding our vein, and it runs in the groove between the two muscle bellies, sternal-hyoideus and sternal-cephalicus muscles. As you occlude, you're going to feel and see the jugular vein filling. We're going to use a 20 or 22 gauge 1 or 1.5 inch needle, advance in as a 45-degree angle, and then seed your syringe or your needle, draw back, and you collect the blood or inject that way. While I'm here, actually no, I'll just keep going the same way. So the second choice is going to be your cephalic. Your cephalic vein runs on the medial aspect of your front legs. You're going to access this proximal to the carpus, and you can usually palpate and visualize that vein. This is good for collection if you needed to, if the jugular veins are not used, or you can use it as a second or third choice for catheterization if your jugular veins are blown. The third choice for your vascular access would be, or your venous access would be your lateral thoracic vein. Your lateral thoracic vein runs the length of the thorax. It is not usually visible or palpable, but you can see it with the ultrasound, and you can catheterize that for fluid therapy if the jugular veins are not usable. And then the last choice for catheterization would be the saphenous vein. Saphenous would not typically be one that we would use on a standing horse, but on a horse under anesthesia, you could use it for collection or for catheterization. You can also use it for regional perfusion of the hind limb. And then the last spot for collection of venous blood would be the facial venous sinus, and this would be used for small volume blood collection for things like packed cell volume or lactate levels, potentially electrolyte levels. We put our fingers on the medial and lateral canthus of the eye, and right where the V is formed in your fingers, right below the facial crest, we insert a 25 or 22 gauge 1 inch needle, and can spontaneously pull out probably 1 or 2 mils of blood. Okay? The rest of the arteries are going to be your transverse facial artery, which sits directly behind the lateral canthus of the eye. You can catheterize this. You can use it for arterial blood gas sampling. You can also use this to check a pulse. There's going to be the facial artery, which runs underneath the mandible. Again, catheterization, sampling, or pulse checking. The carotid artery runs just deep to the jugular vein. This is one of the things you want to be very careful of if you're doing jugular administration of medication, that we're not into the carotid artery. You can palpate this to check for pulses. Actually, I can feel the pulse quite well right now. You could also theoretically sample from here if you're going to use about a 1.5 inch needle and go straight into the carotid artery and collect an arterial sample that way. That would not be a good one to catheterize.
No.
I think that's it, right? Oh, no, my mistake. Radial artery on the inside of the front leg. Proximal, just obviously over top of the radius, very proximal on the medial side of the front legs. Primarily used in babies or on horses under anesthesia. And then the metatarsal artery, or plantar digital metatarsal artery, which is going to be on the lateral aspect of the hind legs, about halfway up the cannon bone. And again, on a horse under anesthesia or a baby is a good place to catheterize or sample an arterial sample.
Okay.
Okay, good.
Awesome. Thank you.